Thank you and welcome to this online webinar, uh, which is about burnout and engagement among PhD students in medicine. It has been increasingly recognized as a global problem, and I think it's our collective responsibility to ensure that our healthcare workforce is happy and healthy and able to work well. So it's a great pleasure to welcome you. And before I move on with the further introductions, I should mention that this meeting is being recorded. So if you would prefer not to be in the recording, I would advise you to turn off your camera. And please be advised that if you do turn on your camera or you speak with your microphone, that you will also be recorded. That being said, I'm very excited to also welcome you to this event, which is also the launch event of the AMY Early Career Researchers Network. As AMY aims to support educators and researchers in the field of health professions education worldwide. This is an effort to also connect specifically the group of researchers in their early careers, which of course is can be a challenging time, but also a fun time, a time for development, and I think a perfect time for building your network. And that is why we are setting up this network specifically targeting early career researchers, so that you can connect with others around the globe. So it's a great pleasure to welcome you to this meeting. And before we move on, I would like to introduce the people who are also working with me on this initiative. So first, my name is Lara Teu, and I'm a PhD candidate from the Netherlands, and I'm working in the field of postgraduate medical education. And I work together with Sai.
Hello, everyone. Welcome from wherever you are in the world. My name is Sai. Thank you, Lara. I'm a PhD student at the University of Bern.
I'm Claire.
Hi, everybody. I am Claire, AMY's Education Officer, and my role in this project is really to support the development of the community. So I'll talk a bit more about how you can sign up and get involved at the end.
Thank you very much. So before we move on with our inspiring speaker, which I think will be great to give you also some ideas on how to support you and others in their PhD. We would like to assess first, like, who's in the crowd with us today. So I invite you to scan this QR code, which will lead you to a Mentimeter. And we'll also post the link in the chat. Can someone do that for me, please? Okay, I hope some of you have scanned the link. If not, don't worry, because it will also appear a code to log into the Mentimeter. So if I can just share my screen. And I will show you our crowd assessment. And I see already some people are checking in and showing us where they're from. So we have people from different areas, a lot of people from Europe. That number is going up, but also from Africa, Asia, Australia. So a lot of different time zones also represented here today. Still looking for some people from the Americas. But we'll see, perhaps they may join later. Okay, let's move on with our next question. I'm very curious to hear, what career stage are you in? Of course, we're targeting early career researchers, but we're also hoping that perhaps some supervisors may have joined us today. Yes, we have some staff researchers. Someone saying other. Perhaps you can post in the chat, what role are you in? We have some postdocs, professors. Perfect. I think a lot of people from different career stages. That will really help with the discussion that we'll have later in the session with you also. And we're also very curious to hear, why did you join this event? What was the reason that made you dedicate your time to this session today? Someone never missed an Amy webinar. That's you're setting the bar very high for us today. That's great. Interesting topic, relevant skills, helps with supervision. Yeah, that's, I think it's why it's great to have also these people from different perspectives. We can see how these perspectives can help each other. Networking, learn about burnout. Supporting, passionate, new ideas. Also, people want to understand better about stress. Someone is a mental health activist, so we're very curious to hear from you later on. Okay, let's move on with the next question. We're also very curious if you're interested in being engaged in this community. What sort of network activities are you interested in for early career researchers network? And if perhaps you feel that you're not as interested in joining this network, of course, you're still very, very invited to stay in this webinar. In that case, you may also skip this question if you feel it's not for you. And of course, your suggestions are also very welcome in these chats. And at the end of the session, we'd also like to hear your ideas in more detail. So a lot of people are interested in online seminars as we're here now. So that's a good news, I guess. Also some online workshops and events at the conference. Perfect, thank you very much. And we're also curious, which medium should we use to keep you updated about the activities? Do you have any preferences regarding that? Now we see that a lot of people prefer email, LinkedIn, community page. There's some people on Instagram, Facebook, Twitter. Perfect. Okay, I'm going to stop sharing my screen. Thank you very much. And it's very interesting to see the diversity of people that we have here from all across the globe, different career stages. And I think without further ado, I'm going to let Sai introduce our speaker of today.
Thank you very much, Lara. It is a great privilege to have with us our guest speaker, Dr. Rashmi Kasurkar. As a medical doctor from India with an MD in physiology, her journey into medical education kick-started as a GSMC Famer Fellow in 2008 and a move to the Netherlands where she pursued her PhD in medical education at the University Medical Center Utrecht, where her thesis focus and her expertise is motivation in education. Amongst Dr. Kasurkar's vast list of achievements include the Dutch Medical Education Association Best PhD Thesis Prize 2014, Chief Organizer of the 7th International Self-Determination Theory Conference, and Fellow of the Karolinska Institute Prize for Research in Medical Education 2019. Now she works as a research program leader in education at Amsterdam UMC, supervises Dutch and international PhD students, and is a teacher and examination board member at her institution. Expanding internationally across the globe, she is a member of the Amy Fellowship Committee and a visiting professor and executive committee member at the University of Indonesia. So I think enough from me now, as I would like to hand over and heartily welcome our truly inspirational guest speaker, Dr. Rashmi Kasurkar.
So thank you for the kind introduction, Sai, and thanks for Lara and Sai for inviting me for this webinar. I'm very happy to be here and very happy to be talking about this topic, burnout and engagement among PhD students in medicine. And we gave it an acronym, we called it the DEEP study. I would like to thank my collaborators, my team members who worked with me on this nice project. And we are all from Amsterdam UMC and one person from Utrecht University. And I would also like to thank the Amsterdam Research Board and the Department of HR from Amsterdam UMC for funding this research. And we couldn't have done this project without the PhD Association of UMC. The PhD student leaders, they really helped us make the questionnaire and get really good response rate and also convert whatever results we found into policy. So this particular study was published as in two parts. The one was the major quantitative study, which was published in Perspectives on Medical Education. And the other part was the smaller qualitative part, which was published very recently in Medical Teacher. I'm going to combine both these and present the two papers together. So what was the background for our research? I would like to explain that first. So there were a lot of news about PhD student burnout. So this was 1 out of 2 PhD students feel down. 1 of 3 PhD students are depressed at the University of Amsterdam. And then there was from Belgium a research that we really need to do research on the mental health of PhD students. This all led to had a political impact, and these questions were raised in the General Assembly in the Netherlands, which means that it became a burning question. And because of this, the PhD network in the Netherlands also tried to look into this issue. Now, when all this happened, the PhD students board from our university, they approached my group. Would you please help us in conducting a survey on our PhD students and their burnout levels? So there was for me, it was very important that we add to the scientific literature and don't do just a measurement. So I tried to look for a gap in the literature. And what we found is that studies about PhD students that are currently in the literature, they focused mainly on success factors in PhD. That means how can you be successful in your PhD instead of well-being. PhD students in medicine had not been investigated as a specific group. It was all PhD students in general. And the reason why we thought that PhD students in medicine is a specific group is because clinical responsibilities can, when you do it along with PhD research, can really make people, put them in a position where it is hard to combine. So we thought that it was important to look at this group as a special group. So the research objectives that we had for this study was on, now before I go to the next part, I would like to explain that we didn't want to look only at burnout, but we thought just not having burnout was not enough for PhD students. We thought that every PhD student should be actively engaged and optimally engaged with his or her PhD work to give the best performance or the optimal outcome of the PhD. So we did not want to come out only with recommendations where how you can avoid burnout, but we felt it was important that everyone is optimally engaged. So we also added engagement to this study. We looked at this through motivation for PhD research, and we looked at some characteristics like quality of sleep, work-life balance, conflict between work responsibilities. And we used a theory called self-determination theory. And in that framework, basic psychological needs of autonomy, competence, and relatedness are important. I will explain this in the next slide. So self-determination theory is a macro theory of human motivation. And it talks about autonomous motivation when PhD students engage in their PhD because they really like it, they have genuine interest, or they do it because they find it important. Both these types are called together autonomous motivation. And autonomous motivation is, for autonomous motivation to be present, 3 basic psychological needs have to be satisfied. The first is the need for autonomy. And autonomy means feeling of choice in action. So whatever the PhD student does, he or she should have the feeling that I'm doing this because I want to. It is out of choice. The second need is the need for competence. And competence means that the PhD student feels I'm capable of doing this. The third need is relatedness, and relatedness means that the PhD students feel that they have peer support or support from the organization, support from their PhD supervisors, etc. So if autonomy, competence, and relatedness needs are satisfied, then only PhD students can be autonomously motivated for their PhD. So based on the framework of SDT, our specific research questions were, how do PhD students in medicine score on burnout, work engagement, quality of motivation for PhD, work-life balance, conflict and work responsibilities, feeling part of a team, and quality of sleep? And we didn't want to stop here. We wanted to look at, can we find patterns in how they score on the burnout subscales? We also wanted to check whether there are differences in the burnout scores of males and females, and clinical versus non-clinical departments, and working with patients versus working in a lab or in an office. Also, we wanted to look at how do PhD students in medicine score on the satisfaction or frustration of their basic psychological needs, the three that I just explained: autonomy, competence, and relatedness. We also wanted to look how are burnout, quality of motivation, work-life balance, etc., how are they associated with each other? And for the qualitative part, our question was, what factors do PhD students identify as the top stressors and energizers in their PhD work? This was our hypothesized model. I will not go into too many details. On the right side, you see the three subscales of burnout. They are exhaustion, that is a feeling of exhaustion, cynicism, that means you feel cynical about the work that you do, and perceived negative efficacy means that you don't feel capable of doing what you're doing. In the middle, we had basic psychological needs, because in the framework, we were looking at whether the basic psychological needs were frustrated or they were fulfilled, and how did that interact with burnout. And on the background side, we had quality of sleep, work-life balance, feel part of a team, etc. The method that we used was, there was a quantitative and a qualitative part. In the quantitative part, we had some general questions like background characteristics, male, female, which department, etc. Work context, whether they work in the lab or with patients or whatever, and quality of sleep. Quality of sleep was, do you feel refreshed after getting up from sleep, and what is the sleep quality? These were two questions. And then conflict between work responsibilities. We used validated scales for measuring burnout, engagement, motivation, basic psychological needs, satisfaction and frustration, and work-life balance. And for the qualitative part, we had open-ended questions on stressors and energizers, the same that I showed you in the research question. Can you identify three stressors and three energizers for your PhD work? We analyzed the data using cluster analysis because we wanted to look at patterns. So we wanted to see, the students, can we make different groups to see with similar characteristics, which are within the group, students are similar to each other on the burnout scores, and between the groups, they are different from each other. So we use these three subscales for making, we subjected them to cluster analysis. And then we did structural equation modeling to test a hypothesized model, the one that I showed before, and we looked for a good fit. And we did content analysis of the qualitative data. The results were as follows. So the response rate was 47%, and we had mainly our participants were between 25 to 34 years. They were females with Dutch nationality, and they were married or in a partnership but didn't have children. And only 33% actually had a Master of Medicine. Which means that there were many who came from psychology and other healthcare professions or non-healthcare professions who were actually doing their work at clinical departments. So 52% worked at clinical departments. And then we had fewer number of students who actually worked with patients. Mainly they worked in lab or an office. So our main results were, when we compared between the groups, working with patients. So PhD students who work with patients had higher conflict between work responsibilities, which I think is very logical, understandable. And in the clinical departments, we saw that, or we found that students had poorer work-life balance, higher autonomy frustration, and higher conflict between work responsibilities. In all the other comparisons, we did not find any significant differences. Then the results of the cluster analysis were as follows. We found three clusters with increasing scores on burnout subscales. So you see that the cluster one was low burnout. 47% of our students belong to this cluster, so there's no problem. And you can see they had low scores on all three subscales of burnout. The second one was moderate burnout scores. 40% of the students belong to this particular profile, and they had moderate scores on all three. And high burnout scores, there were 13% of students in this particular profile, and they had high scores on all three. Then we made cluster membership as the independent variable, and then we looked at how do they fare on all the other variables. So what you can see here is that if you look at the green line, these were students who had low burnout scores. You can see that vigor, dedication, absorption are subscales of engagement. So they did very well on engagement, or better on engagement, I would say. They had their autonomous motivation was good. Their satisfaction of needs, if you look at satisfaction of autonomy, satisfaction of competence, satisfaction of relatedness was good. So overall satisfaction was good. Their frustration was low, and their work-life balance was good. Feeling of part of a team was good. Conflict was low. Sleep was good, and they felt refreshed after sleep. Now, if you look at the moderate, so the moderate just followed, was closer to the baseline. But if you look at the burnout, high burnout scores, that profile showed low engagement, low autonomous motivation. The satisfaction of basic psychological needs was low. The frustration was high. Work-life balance was low. Feeling of a team was not there. Conflict was high. Not high, but more than the others, and they did not feel refreshed after sleep. So this was what we found because we used a cluster analysis. So we could distinguish between people who had higher scores and lower scores. We found a good fit for our the hypothesized model, which looked like this. So quality of sleep directly influenced exhaustion, feeling of exhaustion. Work-life balance also directly influenced exhaustion. So exhaustion, cynicism, and perceived negative efficacy, as I said, were subscales of burnout. And work-life balance also worked through basic psychological needs frustration, and basic psychological needs frustration had direct effects on exhaustion, cynicism, and perceived negative efficacy. Conflict in work responsibilities all had a direct influence on basic psychological needs frustration. So from this, we can conclude that in our hypothesized model, what we found was that basic psychological needs frustration has an influence on has a significant influence on burnout. Going to the qualitative data results. So in our content analysis, we identified 5 themes. The first one was research is challenging. So research was challenging in content. So some students found some of the techniques that were used in their research difficult, data analysis difficult, etc. So all the points that I'm mentioning could be either stressors or energizers. So if they liked the content, it was an energizer for them. If they did not like the content, it was a stressor for them. For building competence, feeling competence in their work was an energizer, whereas not feeling competent was a stressor. And in the work environment and setting, so if there was inspirational work environment, that was an energizer. And if there was work pressure, there was competition, then it was a stressor. The second theme was resources can be limited. So in time, there was a lot of time pressure. We did not find any energizers in this. Uncertainty led to stress. We also did not find any energizers in this. Then guidance. So if there was good guidance from the PhD supervisors or other people in the department or inspirational people outside the team, then that was an energizer, and not proper guidance or led to being a stressor. And recognizing the value of work. So if their work was recognized through having articles, so very concrete products, or through being recognized by their supervisors, that was an energizer, and not being recognized for their work by their team, by their PhD team, was a stressor. Seeing their impact on work on society or on what was happening around them, that was an energizer. And engagement was if they really liked what they did, they were very engaged with their stuff, that was an energizer, and not having the same was a stressor. The fourth theme was experience of autonomy. So if they had autonomy in the time for which they worked and how they structured their work and type of work, that was an energizer, and not having that, having constraints on autonomy, was an stressor. Work-life balance, if there was poor work-life balance, then that was a stressor. There were no energizers in this. And work responsibilities, more conflict in work responsibilities was a stressor, and there was no energizer in this. Relationships were key to success. So the more they felt related to their peers, to their institution, to their organization, to their department, to their PhD team, That was an energizer, and not having that, not feeling part of a team was a stressor. I'll just have some water. And the last was collaboration. So having good collaborations was an energizer, and not having collaboration was a stressor. So based on this and using the SDT framework, we put up this as a possible mechanism for a burnout. In the quantitative study, we found what we saw, that was a proper structural equation model. This is something which we are building on using the qualitative research. So the basic psychological needs being frustrated, that was clearly linked to PhD burnout in the quantitative study. Through the qualitative data, we were able to specify what things cause loss of autonomy, loss of relatedness, and loss of competence. So the themes that we found in our qualitative work, we could pair them with the loss of or frustration of these needs. And the positive model, that is PhD student well-being, being related to satisfaction of the needs, that in the structural equation model, we could not find evidence for it from the quantitative data. But from the qualitative data, we could hypothesize that it does work in this way. So what I would like to conclude is poor sleep quality and work-life balance and basic psychological needs frustration seem to be the most important factors associated with burnout among PhD students in medicine. Our results align with earlier studies among pharmacists in which basic psychological needs frustration was associated with poorer vitality. And further qualitative, more in-depth interview kind of research is needed to gain insight into what measures can be introduced to prevent burnout. And then because we did the qualitative data collection, we were able to give good recommendations to organize at the organizational level, to PhD supervisors, and to students themselves. So I will start with recommendations for organizations. And these are all structured around how can you make sure that the basic psychological needs of PhD students are satisfied. So the first recommendation was organize courses for PhD supervisors on supervision skills, which are obligatory, because some of the comments that we got from the PhD student was just being a good researcher. Being a good researcher does not mean that you are a great supervisor. So supervision skills are important to learn. Provide feedback training for supervisors. So that was very much, that was our recommendation. Provide for sharing supervision expertise and experiences. So the organization should arrange meetings where supervisors can exchange their expertise and experiences. It's a great way of learning and building a community. Making feedback on supervision skills a part of performance appraisals of supervisors. That needs to be an organizational thing. And organizing psychological support for PhD students. So creating PhD communities and advertising it a lot and keeping it visible, because we had that in our institute, but it was not visible and approachable, easily approachable for students. So the last part, in the way information is communicated with people, that is also important. Then the recommendations for supervisors, get training for supervisory skills as an addition to research skills repertoire. Follow training courses specifically on feedback, because constructive feedback, not all supervisors are able to give it. Take half-yearly or yearly feedback from PhD students so that you know you're on the right track. Stimulate a culture of safety, openness, and warmth in the department. That's for relatedness. And participate in regular informal sessions. So informal sessions really came out as important for building relatedness. And celebrate successes. So some of the things that we found was that supervisors don't compliment students on their work enough. So giving compliments is an important thing. Recommendations for PhD students themselves. So my first recommendation would be, if your basic psychological needs are getting frustrated, try to change the situation. Whatever you can do is good. Reinstate autonomy in your work. So sometimes you have a big hurdle in going and speaking to your supervisors, but it is important that you have autonomy in your work. So you need to go and talk about it. Initiate conversations with your supervisors if needed. Break down challenging tasks into smaller steps of competence. So if something is really challenging, data analysis is challenging, try to break it down into smaller tasks and take help, so that every time you reach one level of competence that gives you confidence, and then you can move to the next level. Build a strong community of PhD students to discuss your experiences and problems and to share failures and successes. because during PhD, it can be a very lonely journey. And PhD it's always lots of ups and downs. And when you're going through the ups, you don't need people. But when you're going through the downs, you really need people. Then you know that others are also going through the same thing and you're not alone. There is something called a Covey's circle of concern and circle of influence. Circle of influence means it includes all the things or all the people where you can have influence. So focus your circle on the circle of your influence, because you cannot do much in the circle of concern. So in the circle of influence, focus and try to do whatever you can. And if you have something in the circle of concern, which is beyond your influence, then you need to find people for who this falls in their circle of influence. So you take help from people to make sure that things can change. Also celebrate successes with peers and supervision team. So these are the recommendations that I have for all PhD students. I come to the end of my presentation. I would really like to thank my group, because I couldn't have done it without everyone's collaboration. We did this as a team, and I'm very happy with this the study that we did. I would like to now stop sharing and open the question and answer session. Yeah.
Thank you, Rashmi, for this wonderful presentation. I would like to invite everyone to either post your questions in the chat or to put up your hand in Zoom, so we know that you would like to ask a question. Of course, we don't have unlimited time for questions, so if we do not manage to get to your question within this session, please know that we will ask Rashmi to respond to this in a later time, and we'll post her answers on the network page. So don't feel discouraged if there are a lot of questions coming in. You'll get an answer anyways. So let me move on with the first two questions from the chat, which were, someone was wondering, Tessa was wondering if the data was collected before or during the COVID pandemic. And Jenny also asked if the results varied between the different years of being in a PhD program.
Thank you for both questions, very interesting. The data was collected in 2019. So it was before COVID times. The whole study was done before COVID times. And as far as the second one is concerned, we did not see any difference between the the years of PhD. So there was no difference whether you were a first year PhD student. I think it just means that when you are a first year PhD student, you have different challenges. And when you are a fourth year PhD student, you have different challenges. So challenges are there throughout the journey. Okay. So you're asking me about basic psychological needs. I just saw the question come up. So when you basic psychological needs are psychological needs that need to be fulfilled, and they are called basic because if they are not fulfilled, you cannot have optimal motivation. So the three needs, basic psychological needs, are autonomy, competence, and relatedness. Autonomy means feeling of choice in action. So you choose what you want to do. Competence is you feel capable of doing whatever you're asked to do. And relatedness means you feel part of a bigger picture or part of a bigger club. Is that clear or okay? Thanks, for your question.
Thank you very much, Rashmi, for your presentation. I think there's one other question a little bit early in the chat, which was, did you find lower satisfaction with supervision, for example, due to limited resources in clinical departments compared to other departments?
So that was not a question which we asked. So we tried to look more at conceptually at what is really, how does burnout and engagement, how do they work? But we did not specifically ask them. So what the questions that we asked on resources, etc., they were the qualitative questions. And in that, we did not perform an analysis on the quantitative, like between clinical versus non-clinical. Not everyone who participated in the quantitative part gave their comments on the qualitative part. So according to how, when you quantify qualitative data, you have to be very careful that you follow the principles of what is allowed and what is not allowed. So we used the recommendations of Neil in what things we were going to report and what we weren't. So we did not really look at are there differences between clinical versus non-clinical. But that's a good point. It's something to do for the next study.
I guess there are many opportunities to further work on this. And there are also some more nice questions in the chat. For instance, the question from Eleonora, which is about if there were a difference between local and international students. And I guess that's especially relevant for this international community we have online here today.
Yes, but we didn't see, because there were mainly our students were Dutch students. So we did not really see any differences. So yeah, I can't say that with certainty that that's the case, but in the way our sample was structured, we did not find any differences. This question to the quantitative part of questions, was a survey conducted? Yes, we used Qualtrics for our survey. We find Qualtrics very good, but then we, for the next study, which we wanted to do in our medical students, we were not allowed because of the, what is it called in English? I forgot, the GDP, the rules for privacy. So our institute doesn't allow us to use Qualtrics anymore, but Qualtrics is a great way of having electronic questionnaires. Participants did not have children. This could have had an influence. Yes, I think definitely. So it looks like in the Netherlands, people try to do their PhD before they have children. Yes, the recording, this is being recorded and it will be available. Where is it going to be available, Sai and Lara?
So it will be on the network page of the Early Career Researcher Network community. It will be on that page, but Claire will inform you more about that later.
Okay. Would anyone like to share their experiences or something here? Any, or do we want to go into the breakout groups now? Okay, just a minute.
I see a new question coming in. Excuse me for thinking so, but your study by its name seems to focus on negative aspects mostly, unlike earlier studies focusing on success factors. However, I feel your results were also in the same direction. Am I right?
I'm not sure I understand your question, because our study actually did not focus only on burnout. It looked at engagement. We tried a lot to find out what engages students rather than only saying that what can you do to prevent burnout. So our whole framework is based on how we can get people in the optimal engagement level. And earlier studies, they did not look at the mental well-being part at all. They only looked at what are the success factors in your PhD. That means when are you successful in your PhD? So it looked at if supervisors gave enough guidance, or if the department had a lot of prestige, did that lead to a successful PhD or not? So there were the work on mental well-being. There was no focus on mental well-being, which we did with our study. So the results that we have found, and I will say that for me, the qualitative part of the study was as important as the quantitative part. And in fact, we were able to use our qualitative data to make recommendations which led to policy changes in our institute. So even though it was published as a short communication, I think the qualitative part of our study was very, very important. So my results are not in the same direction as the earlier studies. And perhaps you can have read the papers, both of the papers, and then write an email to me on what you think.
Interesting room for further discussion.
Yes.
And I think there's one question from Martin, which I would also like to add to that, because he asks, would you expect different results now during the pandemic than and after the pandemic than from the time that you actually conducted this study? And I think also if you have any specific advices, because I guess a lot of people who are here present today may be struggling with the effects of the pandemic on themselves, right, or PhDs. So do you have any advices also? That would be great.
I would say that I can expect different diffuse effects, because as far as the autonomy is concerned, so people who have clinical responsibilities, their workload has really increased during the pandemic. So they would be struggling to find time for PhD. But I think also, and also in some places, data collection has been affected during the pandemic. But if you don't have those problems, then actually PhD, it gives more time to do your work. So you have more autonomy when you're working online or you're working from home, and you can really look at how you want to structure your time and what you want to do. So if you look at medical education as a field, the number of submissions of papers has really skyrocketed. So I think people are still able to be productive, and the aspect that people really miss is the relatedness aspect. And that you can do, like what I do with my team, with my PhD students, is that we always had on Thursday at 4 o'clock, everyone is going to join on Zoom, and then we are going to just have an informal chat. The chat would also talk about, we would also talk about work-related things, etc. But we spent a lot of time on talking about how are you doing, how is your family, what's happening, how are you feeling, etc. So we had this reserved time every Thursday to check in with everyone and then just have a laugh and discuss what we did or what we did on the weekend. So informal contact with people, that's very important for your relatedness. So I would suggest that even if you're not able to meet in person, if it is possible, do that. If you're not able to meet in person, do at least have coffee with each other online. So lots of activities can be structured around using the concept of relatedness. I see a question on that students who are not connected, the PhD association might have missed. I agree with that. That is a bias that would be there, response bias in the survey. And we advertise it as much as possible. So we try to make it, if we had gone on our own, I think we wouldn't have got such a response rate. It was only because the PhD student association was fully backing us and advertising it everywhere. Because of that, we were able to get this response rate. So their support and collaboration was invaluable. And that was also the reason why we were able to bring about policy changes in the PhD support. So if we had done it on our own, I don't think we would have had the same impact.
Perfect. I guess this leaves us to move on with the breakout rooms to also give you more opportunities to share your experiences. Well, thank you and welcome back. And we apologize for the technical challenges at the start of the breakout rooms, but we hope you had lovely discussions and were inspired also by the experiences of others, and were hopefully able to share some ideas and tactics with each other on how to increase your engagement in your PhD. Let's frame it in a positive way. Rashmi, would you like to share anything just to wrap this part of the session?
Well, I would like to say that if from this session people remember that they should look out for satisfaction of autonomy, competence, and relatedness in their PhD work, and if they can try to rearrange or organize things for themselves so that their basic psychological needs are satisfied, and if it is beyond their influence, then contact the people who can help them influence things. And that was my main message. And if people have taken that message home, and supervisors who are present here have taken that message home as well, I think my work for the day has been done.
Thank you very much. And I think those are very inspirational words and very helpful for all of us across the globe. So thank you very much. And I would like to give the floor to Claire to share a little bit more about the PhD initiative.
Thank you, everyone.
Thanks again, Rashmi, for a really great webinar on a really important topic. I will be quick. I realise we're over time now, but I just want to let you know how to keep in touch with us. So I'm going to put a link in the chat now to a SurveyMonkey survey. This is really, it's not an extensive feedback. It's more of a chance for you to sign up to our community to be updated on future plans. We are recruiting people. So Sai and Lara have done a great job of getting this off the ground, but we need more people. They can't keep doing it on their own on top of their PhD work. If you or any of your colleagues are interested in joining an organising committee, we hope it won't be a huge amount of work, but you're the people that know what you need and what you want from a PhD network. So please use that form to sign yourselves up and volunteer to join our committee. We do have a community set up online. If you visit our website. This is not the main AMY website. This is our services portal for members. The link that I've just put in the chat panel there is to the services website. You will need an account. It's free to set up. So if you don't have one, just click the sign in button and you can create an account. Once you're there, click the communities tab, and then you can see the Early Career Researcher Network online space in the communities list. If you click follow at the moment, you will get a notification for every post that's in there. So you might want to just, we're looking at how we can reduce the amount of unwanted emails that are going out from that. But for the time being, you might want to just check back periodically to see when the recording is posted. If you do want more information, this is the email address to contact us on, services@amy.org. We will send you out information about signing up to the community or joining the organising committee. We don't have time to have breakout rooms today, but we will organise a open Zoom meeting for anybody who does want to talk to us about what they want to get out of this community going forward. And Lara has created a Padlet which you can use in the interim to give us your feedback and suggestions of what you would like to see. We are not being strict at the moment on who is included under the early career researchers topic title. Even if you're 6 years post PhD and still struggling with getting your research career off the ground, please sign up. You know, the more the merrier at this stage, although the target audience is really PhDs and post PhD. We don't want to exclude anybody who feels it would be a useful community for them. So that's the end of my part. Thank you all again for coming. Lara, do you have any final things you want to just say?
No, I just want to thank all our participants and our lovely speaker of today. And it was a great inspiration to see so many people engaged with this topic and also in this network. And we're looking very much forward to speaking with you in the future, online or perhaps at the AMY conference. And please keep in mind also the registration deadlines and the abstract submission deadlines for the AMY conference. And we look forward to seeing you also there, but perhaps earlier also online.